I'm curious, what do you guys think of medical doctors, medical professionals taking payments from pharmaceutical companies or from medical device manufacturers? Does that influence their prescribing behavior or whether they're using certain equipment? I'll answer that in just a second. What's really interesting now is you can actually go on to openpaymentsdata.cms.gov and you can look up a doctor to see if they've received any kind of payments or kickbacks from pharmaceutical companies or medical device manufacturers. In 2022 alone, the number that was paid out to medical doctors and medical professionals was $12.59 billion in foods and gifts and donations and speaking fees and consulting fees. You know where I'm going with this. Now, I'm not the first person to be asking this question. They asked this question about 3 years ago, and it was published in the Annals of Internal Medicine. The title of it said, "Are financial payments from the pharmaceutical industry associated with physician prescribing?" And it was a systematic review. After looking at the data, not surprisingly, their conclusion was, yes, there's an association between payments from pharmaceutical companies and physician prescribing. And now I'm going to give you an example. Now, I'm going to call out an individual, and I don't usually call anybody out. I keep to myself, unless you decide to come onto my page and make really stupid arguments and ad hominem attacks, and you just start running your mouth. I'll even warn you, but this guy just wanted to keep going. So does this gentleman take payments from pharmaceutical companies and medical device manufacturers? The answer is why, yes. And in fact, in 2019 and 2020, he took a whole lot. I wonder what kind of consulting fees those were. And I wonder if that influenced what he was using for medical devices and or pharmaceutical drugs. Dr. Shim, you can call me every name in the book, but you know you can never call me? Bought and paid for.
Drop it.